Why should everybody learn this?
To get out of the medicine.
There are hundreds of scientifically proven medicines nowadays.
All medicines are practically proven to give a relief.
Do you have any proven method that this works better than any other medicines that is available? Sir?
Yes.
Hello everyone, welcome to BasavaAcuAcademy. Today I am with Dr. Basavara sir to ask him questions regarding all the other questions that we all get in our minds on a day-to-day basis. Welcome sir.
Namaskara.
So what exactly is this TEM course all about, sir?
The traditional energy medicine course is a combination of TCM, traditional Chinese medicine, and Ayurvedic philosophy, both. And we summarized and simplified the entire concept of traditional Chinese medicine with Ayurvedic concept. I took the meridian concept and acupuncture points from the TCM and food concept from the Ayurveda. I merged and created this course so that a layman can learn this course and they can practice from the day one and they can get the results.
To whom is this course all about, sir?
This course is for whom want to heal themselves and they want to become a healer, they want to practice, and to whom they want to create their profession in healing field. And nowadays medicine is everywhere and medicine is in every home, and people are taking lot of medicine to get just a relief, not the cure. If you want to cure, you have to change the body energy levels. So that can be done with through meridians and chakras concept. It's a age-old concept and people are just reading and learning and try to implement in smaller way. But in BasavaAcuAcademy since 15 years, we did extensive research on marma points, acupuncture points, and traditional way of food. Definitely anyone can learn this and practice this and they can get the changes within 3 days. We are very confident who are learning this acupuncture concept and traditional energy medicine concept, whether you are applying or whether applying for others, and they can show the results just within 3 days. We are using only methi or pepper and biol meridian, putting for 10 to 15 minutes only, and that will bring changes within 72 hours.
Why should everybody learn this, sir?
Why we should learn means to get out of the medicine.
There are hundreds of scientifically proven medicines nowadays. What is the huge difference between that and what you are
All
telling
medicines
me, sir?
are proven to get the relief. So you are taking gastric medicine, it's a relief. You are taking BP, diabetes, thyroid, and headache, back pain, painkillers. All medicines are practically proven to give a relief. If you ask anybody who are taking medicines for antacid medicines for a digestive problem, acidity and gastric problems, ask them. They are telling, I am taking since 5 years, since 10 years, since 20 years. When you are getting relief, then your body is not fighting against it. It is not trying to cure. So once you get relief, even yourself and your body, your mind, your nerves, everything, you are creating a pseudo signal to brain. You are not trying to heal. Instead of you are postponing healing. How many years you postpone? By postponing medicine only, the one medicine become 10 medicines.
Do you have any proven method that this works better than any other medicines that is available?
Yes, I already proven. I have more than 20,000 students and lakhs of patients we healed, and I have clients in every part of world, and this method is proven. That's what people are joining in thousands of people are joining this course.
What are the challenges to learn this course?
Definitely, it's not easy like learning medicines, learning biochemistry. If you go to any of the doctors, it's easy to treat the patient. Even if you become a doctor, it's easy. So already diagnosis report is there, blood report is there, scanning report is there, and already medicines also matched. Okay, you have a fever, you take this paracetamol. You have a pain, you take painkiller. So you have a gastric, you take this medicine. It's already matching is done. What is your job? As a doctor, you are just matching and giving. Maybe in future with AI, that can be done with machine itself. But in TEM is not like that. In traditional energy medicine, the challenge is the way you diagnose. It's not easy like that giving a pill. No. Giving pill is giving relief, not the cure. Just take the example of headache. If you want to cure headache as a TM students, as a healer, you have to use a lot of logics in your mind. First, if you get headache, I am asking where is the headache? If you are getting ear, it is the stomach. If you are getting side, it's a gallbladder. If you are getting top, it is the liver. If you are getting back of the head, it is a kidney and bladder. So if you are getting around the eyebrows, it's a spleen. So lot of meridians and organs are involved in simple headache. But headache medicine is designed to give relief, not the cure. That's what in clinical practice, everyday clinical practice, lot of people are coming to me, they're taking medicines since long years for just to get the relief. But if anybody getting headache one side or full overhead, heaviness of the head, all can be systematically diagnosed and cured. But to do this, you have to spend 1 year here to learn. But once you learn this, your experience is 15 years because I am giving all my experience to you.
So who all can learn, sir? Okay, for example, some housewife is there, anybody who has no medical background, or maybe somebody who doesn't even know, because you keep telling that, okay, anybody can learn it. So how does that help them? People who have not studied anything, or those who don't have any medical related knowledge at all.
Leave it about the medical knowledge. People are learning this course who don't know how to read, how to write.
How does that happen? How does that actually happen?
See, that is our ancient science. You no need to learn where is the liver, where is heart. It's not required. Okay. Here we will teach you the meridians, and we are teaching you the Vata, Pitta, Kapha energies and Pancha Mahabhutas. How is coldness? How is dryness in the body? How is humidity? How is Vayu in the body? The wind energy. So we are teaching energies to learn this, because even you are with a background of MBBS, MD, MS, if you are joining my course, or if you are joining course as a scientist, even anybody joining the course who don't know how to read, how to write, for all of them, my concepts are new. And complete the way you analyze is different. For example, for the doctor's art is here, but I am teaching you the art meridian, not the art. So this is the art meridian, starts from the little finger and across the hand and it goes here. So once you get the energy variation in the art, you get the variation in the little finger, either numbness or pain, or you feel the pain along the meridian and you get the left chest heaviness. So all these things we teach based on the meridians. So whether you studied or not studied medicine doesn't matter here. We are teaching you from the scratch, from the zero. The only who want to willing to learn new concept, who want to learn drugless medicine, just empty your mind and join this course.
Sir, you talk about energy cannot be seen at all. So what is the big difference between what you said about ancient science, Vata, Pitta, Kapha, and the medicines that are actually proven we can actually see? Okay, you're telling me about some meridian which I can't even see. So how does that actually work? And
See,
why?
that's
What is the thing
at
about
once
it?
you cannot believe. The moment you see me once, first time, you can't believe this. But once you experience it, you can't leave me. See, that is the power of this healing. So BasavaAcuAcademy created thousands of healers, not by showing something, by experiencing something. For example, I can create headache for you. I can create gastric for you. So there's a two different signs. One, put endoscope and check what is going on. That is visible signs. The second, what is the energy of the stomach? That you can feel in the third pulse, right hand. This is a wrist line. This is Vata, Pitta, Kapha. In the Pitta position, the first position, this is your stomach position. Just check this. If the pulse is beating better, it's your stomach is good, having good energy. Once it is feeble and slow and deep, that means your stomach, Jataragni is very low. Today you may feel fine, but I am very sure in coming days your digestion is going down. That's how very precisely you can diagnose. So this pulse diagnosis I am not created. This is there since 2000 years. If it is not working, it is not good enough to diagnose, it would have disappeared many years back. It is not disappeared till people are practicing. Why? Because it's working. Because through pulse you can diagnose the body much ahead only. For example, if any diseases which you diagnose in the chemical level through blood reports, before that, before 3 months, before 6 months, first it changes in the energy levels. There is no instrument to diagnose energy level. All the medical instruments which is designed to diagnose your structural level and chemical level. But in BasavaAcuAcademy, we designed this Nadiswara device, and it has a simple sensor. That sensor you can connect to your mobile and place the sensor on the radial artery ear. Within a minute, you can sense your Vata, Pitta, Kapha and Pancha Mahabhutas and even yin and yang energy levels. Through this, you can diagnose the disease much ahead and you can balance the energy and you can come out of the symptoms very easiest way. So definitely overall attending this TEM course, they also get this instrument, Nadiswara instrument, and definitely they can practice with this instrument.
Sir, okay, so we have a lot of development in the science and we get a lot of intricate scanning reports. How accurate is this device of yours, sir? And is this the only way to diagnose? Is there no other ways to diagnose it?
No. There is so many energy diagnosis devices. Frequency analyzers are there. Kirlian photography is there.
So what's the difference between the available device and this particular device that
so many devices that is based on the frequency, vibrational medicine, and many other depends on aura energy. But our device, Nadiswara, depends on pulse, radial artery. We designed the sensor. Through sensor, I am just pulse. See, it's just like checking the pulse physically. If you want to expertise in pulse diagnosis, it takes few years. But through this instrument, you can diagnose much easier way. And it is giving a detailed report, 6 pages report about you. And it is explaining what is the root cause of your disease. It is not only explaining that, it is also predicting. If you are not treating this energy imbalance, what happens after 6 months? So Nadiswara, based on AI, it is predicting the device. It is predicting the symptoms.
So what all do you cover in this TEM course, sir?
In this TEM course, we cover the much important topics in Ayurvedic principles like Vata, Pitta, Kapha and 5 elements. And in traditional energy medicines, we cover about yin and yang principles and meridian concepts and acupressure points and many more. And all complete course is designed without medicine.
So any layman can use it, sir?
Yes.
So definitely. How long does this help in treating even the chronic diseases where people are taking medicines for a long term and still not able to come out of it?
Definitely. It's a very good question. People are thinking that by learning all these things, I'm not only curing your cold, cough, fever, it is curing even chronic diseases. In fact, every day I consult around 200 to 250 patients. 99% of the patient whom I give consultation, all are chronic, which already they tried many other medications and they are coming here. For them, we are giving best result means just think. We are not learning this course just to get the acute symptom relief. Even it is a diabetes, blood pressure, or CKD, or knee pain, back pain, spondylosis, anything, even sciatica, menses problems, infertility, sexual disorders, many more things. Because we believe all your symptoms because of energy imbalance. If you learn about energy, if you learn how to balance it, definitely you can cure any disease.
Sir, you keep talking about energy, energy, energy. What exactly is the energy? Because none of us can see it. So, how exactly is that useful? Or how does that help?
Okay, you are talking with loud, better voice. How you got that voice?
It's just the way to talk and whatever the situation demands for it.
That's what. If you have energy, your voice is loud.
Okay.
Okay. If you don't have energy, you talk very feeble voice. Hello, sir. ಹೇಗಿದ್ದೀರಾ? ಊಟ ಆಯ್ತಾ?
Okay.
The energy is the one which creates the sound. Energy is the one, it's a fire. Without fire, no voice. Without fire, no digestion. Without fire, no circulation. So, energy is a functional value. The functional, if you want to work any organ, we need circulation. That circulation is because of the yang energy. In Ayurveda, we call it as a pitta or fire. In a traditional Chinese medicine, we call it as a yang energy. Okay, or essence. So definitely, energy, you are alive because of the energy. Once energy goes down, 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 your functional value, the functional energy of the organs go down day by day, day by day. But there is no medicine to improve the function of your organs. But instead of that, we are masking, we are hiding the symptoms with painkillers, with some other medicines. Instead of that, learn how your organ is working. What is meridian? What is chakra? How can you strengthen your organ by increasing energy of it? Always in TCM we believe two energies, yin and yang. Yang means energy, it's functional. Yin is a nourishment. So if any organ is not working means it is not getting proper raw material. Each and every organ, it requires in special minerals. It's not only glucose, oxygen, protein. It requires some minute, different, small nutrients. It may be vitamins, it may be amino acids, it may be minerals. So that can be given with the right, good quality food. That we will teach you in the TEM, Traditional Energy Medicine course, so that you can strengthen your organ by choosing right food, and you can strengthen you can increase the function of the organ by increasing the energy to it. How I am giving energy? Through acupressure, through color, simple. For example, if you want to increase the energy of your stomach, so this is your stomach reflex in Sujok. So just apply sky blue color here, daily 3 to 4 hours for 1 week. By next week, you don't have any acidity, no indigestion, you get proper hunger, your motion will be normal, everything is super. If you feel it, then use it. So energy can be modified from one form to other form. You know that the thermodynamics principle, energy neither be created nor be destroyed, but it can be transformed from one form to other form. That's what I am doing as an engineer, as a scientist, I am doing same principle through acupressure point. For example, if anybody is having stomach coldness, that coldness I am converting into heat by putting color or by putting pressure or by putting seed. Same thing if somebody is having excess of heat, that heat I am converting into dryness, I am converting into wind. I am converting one form of energy to other form of energy through acupressure and acupuncture point. I am using the modality of seed therapy or color therapy or pressure point. In TM, we are not using acupuncture needles. No, once you start, if you want to use needles, you need a legal permission. You have to do 5 years course for it. Instead of that, no need to prick, no need to use any needles. Instead of needles, I'm using methi or pepper on the acupuncture point. Within 72 hours, you can give a great relief or improvement in the symptoms to any patients.
So there are a lot of degrees coming up, and a lot of nutritionists have already available in the. There many people are taking the course, and they can precisely tell you how much of grams of nutrients we want and all that. Okay, whatever you said, sir, but when the supplement is very easy and it is working in the same way, people are getting benefited out of it. So what's the difference? Huge difference between what you're telling and what people are doing.
No. What people are doing, I'm not telling it's wrong. I'm telling to fine tune it.
Okay.
For example, you are asking to heat the people in the form of proteins, carbohydrates, fat. In the same way, I'm telling the people to heat the food in the form of which food creating the fire, which food creating the kapha, which food creating vayu, vata, pitta, kapha and panchabhutas. Definitely, it has a huge difference. For example, if you take mutton and chicken, according to nutritionists, both are protein rich food. If anybody want to give protein, you can give. But in our experiment, chicken is giving a lot of heat to the body and mutton is giving the coldness. Okay, so you decide whether you want to take chicken or mutton based on your body constitution. If you have a pitta constitution, take mutton. If you have a kapha constitution, take chicken. Okay. If you don't know about this concept, you simply ending with something else. For example, many people, they are coming here by taking lot of chicken and their body heat increases. They get the gastritis, air fall, constipation, piles, like this. I'm not telling you to stop something else. Before taking anything, just try to analyze energy of it. You are already analyzing what is the nutrients. You are already analyzing the mass. You analyze the energy of it. So in BasavaAcuAcademy, what we designed this traditional energy medicine course, we did lot of research on 100 of fruits, vegetables and millets and even greeny leafy vegetables. We precisely give you the information, what is the energy of the food, when you can take, either in the morning or in the evening or in the night, whether you can taking in the summer or you can take in the winter or you can take in the rainy season. This precision is very much needed for the layman. Many people, they are taking wrong food and they are ending up with some other problems because of the food only. Today, with my experience, 80% of the diseases which is happening because of the food.
So, but the available food source itself is like that. So, what can we do about it?
We will tell that also. So,
but
what is
not
the energy
entire-
of genetically modified food and what is hybridization and what is the source of energy and why you should choose native breed food and how it is carrying energy from the earth to your stomach.
So, but not everybody can afford it, right? So, whatever, most of the market is filled with the available foods. Nobody has time to go sit and research about it. But people who are eating are, most of them are fine. So, what difference does it actually make?
You're telling one wrong word. People are eating food, most of them are fine. No. See, 25-30 years back, medicines are very rare. Now, in every home, there is a medicine. Because of this hybridization only. Because of genetically modified food only.
Okay,
We will teach you.
Including the milk and stuff, basic people who are living in urban cities, they're getting access to the organic food.
Why you told? In Bangalore, in 2012, I thinking start of Basava Organics, one grocery shop. Because of so many other research work, I didn't do that in 2012. Now it's 2020-25. In last 13-14 years, in Bangalore itself, more than 3,500 organic shops are created. Just imagine, it's available. Organic food is available everywhere. Just you need to search. Even nowadays, even all social media, even all online stores, platforms, everywhere the organic food is available. As you told, maybe it is not affordable. Definitely, will create social awareness and will create in the mass production so that people will get in the lower price.
Sir, and you tell very precisely the changes that will happen. So there are a lot of, for example, if you take skin related, hair related, so a lot of them, except for the genetics, many are facing the problems, and they are whether it is hair transplant industry or any other, they are giving you the precise result. So how, just by applying some color, some pressure points, how does it actually help?
Your question is right only. First, you should understand your body. What is your nature of the body? Whether it is a vata, pitta, kapha. For example, if you are a pitta nature, what is pitta means? It's a fire. Obviously, built in, you have a fire in the body. So, the moment you reach 30, 35 years or 40 years, with that heat nature, definitely you lose air, and you should accept it. This is your body constitution, this is the way. And if you try a lot of supplements, this, that, and all, definitely you are harming your body. Of course, you can use some other cosmetics to hide that. But finally, we train you how to diagnose, how to understand your body with based on energies. Definitely, there is some reasons for hair fall. Maybe blood deficiency is there, and maybe excess of heat is there, and some other nutritional deficiency will be there. We will teach you systematically how to overcome it and how to treat that.
So the only method of treating all this is through this TEM course.
I'm doing only two things here. One, through acupressure and marma points, I'm balancing energy, and by giving right food, I'm giving the food supplement. Instead of using food supplement or some other medicine, I want to use food as a medicine. If you want to use food as a medicine, you should understand the food first. What is the energy of the rice? What is the energy of the wheat? What is the energy of the millet? People are simply eating everything. No. Wheat is giving wind energy. Foxtail millet is giving the fire. Jowar is giving humidity. Rice is giving dryness. So like that, each and every millet has its own energy. Nobody is telling energy, simply telling the this, that, and all. But that you can learn here.
So you are just getting back a lot of old ancient science
Yes.
back. So nowadays, anyway, everything has become a marketing gimmick, sir. So is what you are doing is also a part of a marketing gimmick?
It's a right. You think like that. I'm doing gimmicks and all by seeing my videos. So any gimmicks won't work in large platform, because I created 20,000 healers. Especially in Karnataka, I created around 6 to 7,000 healers. You go to any part of Karnataka, any city in Karnataka, any village in Karnataka, you can see my student. You can see their practice. You can see their results. Small gimmicks works only in the shorter time. I am here since 15 years. If I am doing gimmicks, I cannot create this huge platform for the students. And people are joining in thousands of people are joining here means it's only because of results. I'm doing this course, traditional energy medicine course, just with results, nothing else. I'm giving points, some acupressure or color therapy points. You can see the changes within 72 hours. If you feel changes, then join the course.
So for the last question, for the amount that I pay for the class, what is the output that I get, sir? Is it worth what I'm What you just tell me in simple words, if I am investing this much, what am I getting back?
See, what you are investing, it's not even 1% what I am giving to you. Because it's not my word. People who already did traditional energy medicine course, since 2012 we are doing this course. Many people, they changed their lifestyle, their food and their profession, and they are living healthy. Just imagine you are suffering 8 to 10 years with one symptom or disease that yourself you are able to cure within 1 or 2 months. Just you only tell me how much the course cost. So definitely I can charge in international market, I can charge few lakhs of rupees. I can do right now, but if I do that, I cannot reach the common man. Our vision is very clear. We want to create healer in every home. 50 years back, it's not needed because everyone knows what is Vata, Pitta, Kapha, what food I should take, what food I should not take. Everyone knows in every home. But today, people forgotten that. They switch over to the chemicals. It's our social responsibility to give my research to the common man. If I want to give this, definitely I cannot charge in lakhs. I will charge very minimum course, very minimum charge, so that even auto driver is learning this course, farmers are learning this course, students are learning this course, and retired age old people 70 plus years, they are learning this course. Just imagine a common man learning this course means how much I reduced. So definitely cost is not at all a matter here.
So, sir, with all this, are you telling me that you are changing the whole social revolution and movement with this?
Yes, this social revolution I am bringing, I am off the way again already. Already I did something. In you go to any city in South India, you can find med students, you can find their practice, and in larger way through social media, through course, we already created thousands of healers and we treated lakhs of people. Definitely, BasavaAcuAcademy bringing social health within short period of time.
Okay. So, as we all heard him today, so let us all join the upcoming traditional energy medicine and see the changes that brings in all our lives. Thank you, sir. Thank you for the
Thank you very
input.
much.